Hello, and we are going over a huge topic today. Today is female pattern hair loss. We're going to talk everything. We're going to give an intro. We're going to talk hair basics. We're going to talk the causes of female pattern hair loss, the signs and symptoms, how we diagnose it, the treatment options, everything from topical to injections to oral to cosmetic treatment options, finally lifestyle interventions, and also how you can get support. First things first, what is female pattern hair loss? Female pattern hair loss is also known as androgenetic alopecia. Andro meaning male hormones and genetic meaning inherited. What it looks like gradual thinning of the hair, mostly on the crown, which is the very top of your head, and near the temples. It's very common. It affects about 40% of women by the age of 50, and as we get older, it gets more common. One of the most important aspects of having female pattern hair loss is its impact on your self-esteem or even emotional distress. And I just want to emphasize, do not be embarrassed to ask for help. As dermatologists, we see female pattern hair loss every single day. Sometimes patients come in and they start crying. That's okay. We understand. It's happened before. It'll happen again. I just don't want you to be embarrassed about asking for help for this chronic condition. Next, let's go over the very basics of the hair growth cycle. The hair starts in anagen phase, which is the active growth phase of the hair, and this lasts for years, and the hair gets longer and longer. And then catagen comes, and the hair stops growing. And then telogen is when the hair rests, and then it eventually falls out of the hair follicle. And the cycle starts all over again. Now, what happens if you have hair loss over many, many years? In the beginning, our hair follicles are nice and thick, and they're deeply rooted in the skin. Over many years, there's some type of injury to the hair follicle. It could be caused by genetics or hormones, nutrition, stress, something's happening. And this causes the hair follicle to get smaller and smaller, and it goes up further and further in the skin. So we can see the difference here between healthy hair where the follicles are nice and thick and deep in the skin versus this example of hair loss where the hair is more sparse and it's more superficial in the skin. And we can see the obvious difference here between the healthy hair where the hair strands themselves are nice and thick versus the hair loss where the strands become thinner and finer. Now, a question we get all the time from patients with female pattern hair loss is, will I go bald? And the answer is no. Patients with female pattern hair loss, the hair will get thinner and finer. Patients who have a total loss of hair generally have an autoimmune condition that relates to the hair follicle. Female pattern hair loss is in a totally different category, so no, you will not go completely bald. Now let's talk normal shedding. Normally we shed between 50 and 100 hairs per day. And what does this look like realistically? Well, this is about 10 hairs, this is 50 hairs, and this is 100 hairs. These are all fine. This is normal. What about if we get higher? What about 300 hairs, 500 hairs, 700 hairs? This is not normal. This is when it's time to go see a physician. On to the causes of female pattern hair loss. The primary cause is genetics. Family history is a key indicator, and the family history is important on both sides, both mom and dad, males and females included. Another cause is due to the male hormone DHT, or dihydrotestosterone. This is very toxic to the hair follicle, and over time, it's what causes the shrinking of the follicle. Also, menopause and hormonal fluctuations in general, PCOS or polycystic ovarian syndrome, also chronic stress. It makes everything worse, including hair loss. Also, a poor diet. If your hair doesn't have the foundational strands to build itself, then it's going to have a hard time. How do you know if you have female pattern hair loss? Let's talk signs and symptoms. First of all, you may see thinning on the crown. That's thinning on the very top portion of the head. Also, thinning hair on the temples near the hairline as well. You may also see a widening of the part. Normally, if your part is very thin and it becomes a little wider, that's another sign. If you notice increased shedding on your hairbrush, pillows in the shower, that's another sign. And you may also have texture changes as well. Usually the hair becomes finer, but sometimes it becomes more brittle or also like kind of kinky in nature. So those are things to be on the lookout for. And how do we diagnose female pattern hair loss? Usually in the dermatologist's office, and early diagnosis is crucial. If you go to the dermatologist, some of the things we ask will include how old were you when it started, what medications are you on, your medical history, your gyne or OB history, if you've had recent stressors, what supplements, what's diets, any family history of hair loss. There's a lot of things that we ask. We'll also look at your scalp with our trusty dermatoscope, which basically just gives us a magnified view of the scalp. Normally, the scalp has those thick strands of hair, and hair loss, this is what we see. So the strands of hair become thinner. Not all of them, just some of them. Your dermatologist may or may not order labs. When we do order labs, we're looking at things like thyroid, testosterone, iron, ferritin, vitamin D, vitamin B, things like that. You may or may not also have a scalp biopsy. If we do biopsy the scalp, we usually biopsy 2 areas, and we biopsy in the area of hair loss, usually on top, and then we also take another biopsy from the back of your head, which is usually unaffected by hair loss. So then the pathologist can look at them both and see the differences between the two. Okay, onto the meat and potatoes. How do we treat female pattern hair loss? We usually start with topical Rogaine plus or minus a pill called Spironolactone. Either of these things you have to trial for at least 6 months to figure out if they're working or not. If it's been 6 months and you've seen no improvement or little improvement, there are a lot of possibilities. There's things like Finasteride, which is a pill, oral Rogaine, which is Minoxidil, PRP injections, that's when we take your blood and inject it into the scalp. Low-level laser light, something you can buy online. Also, there are topicals you can use. You can microneedle, you can micro-roller. There are cosmetic treatment options, sometimes covered by insurance. And lastly, a hair transplant. For hair loss treatment, we're really trying to find what works for you. For some medical conditions, we have a really strict algorithm of things that we try first, and then second and third. For female pattern hair loss, it's usually Rogaine plus or minus Spiro, and then after that, it's more of a discussion between you and your doctor of what may work, what may not work, what's good for your lifestyle, things like that. Broadly speaking, there are 2 treatment groups that these medications fall into. The first is a group that decreases that hormone DHT, which is damaging to the hair follicle, and the treatments in this group are Spironolactone and Finasteride. The other broad treatment group is increasing the health of the hair follicle, and this is everything else, Rogaine, laser light, PRP, everything is trying to increase the health of that hair follicle and sustain hair growth. Let's talk specific treatments. First, topical minoxidil, or Rogaine. It's over-the-counter, it's FDA approved, and it improves blood flow to the hair follicles, meaning that it can improve growth factor and nutrient delivery to the hair follicle. Patience is key because it takes about 4 months minimum before you can decide if the Rogaine is or is not working. As far as side effects, you can have an initial shed, that's where your shedding gets worse at first, but then it evens out. It can also cause some local irritation or increase hair on the body or face. Since this is female pattern hair loss, I think it's very important that we discuss the pink tax. On a certain website, I won't say which one, but I bet you can guess which one, you can get men's Rogaine. 3 bottles are $47. On that very same website for women's Rogaine, you can get 2 bottles for $48. And you may say, well, maybe they're different. May I present to you an enlarged version of the bottle? So you see men's Rogaine, women's Rogaine, both are 5% minoxidil topical aerosol. Both are 60 grams. The only difference is the men's bottle says not for use by women. And you may think, like I did, well, maybe there's different ingredients in the men's and women's. May I present to you the ingredients for both the men's and women's? I'll save you the time. These are exactly the same. Why they charge more for the women's Rogaine, I don't know. I would love for somebody from Rogaine to chime in, but I'm sure they'll come up with some BS answer. But if you're comfortable using the men's Rogaine, it's the same thing. It's cheaper. Just use the men's. All right, I will get off my soapbox and on to Spironolactone, which is a pill that you take daily. It reduces the amount of androgens in the blood, which is basically the male hormones, and again, it takes about 6 months to see the effect of the medication. Side effects are dose-dependent. It can include headache, menstrual irregularities, low blood pressure, or high potassium. And Spironolactone, you must avoid pregnancy when you're on this medication. And this works because it blocks the DHT from being able to get to the hair follicle. So a bit different than other treatments that we'll talk about, but also protecting the hair from DHT. All right, so we've covered topical Rogaine and Spironolactone. Now let's move on to the many possibilities that you can go with if these 2 do not work for you. First of all, Finasteride. Speaking of DHT, Finasteride blocks the conversion of testosterone to DHT. So there's less DHT around to damage the hair follicle. Finasteride is pregnancy category X. As you can imagine, if you get pregnant with a male fetus and you're blocking testosterone, it can cause a lot of problems. So we we often use finasteride in postmenopausal women or women who have a really good form of birth control, like an implant or an IUD. All right, on to our next option, oral Rogaine or oral Minoxidil. Minoxidil was originally developed for high blood pressure, but they saw a weird side effect that had also increased hair growth. It's theorized that this is due to vasodilation, that it is able to transport more nutrient and growth factor to the hair follicle, and that's what helps the hair growth. Side effects of oral Minoxidil: low blood pressure, high heart rate, sometimes leg swelling as well. Let's leave the oral medications behind and onto PRP injections, or platelet-rich plasma. So what is it? Let's say you get a cut on your hand and it's bleeding. Platelets are the cells that are circulating around in your bloodstream that rush to the scene of the injury. They're like the first responders, and they are chock full of something called growth factors. So they're rushed to the scene and they have to rebuild stuff. They can rebuild vessels, they can rebuild skin. So chock full of these growth factors, and when we inject platelets into the skin, it uses these growth factors to help further stimulate the hair follicle. So practically speaking, how do we do this? Well, you come to the office, we draw your blood, we spin it down in a centrifuge, we take out the portion of your blood that's rich in platelets, and then we inject those into your scalp. PRP injections are generally not covered by insurance. Next, a device called a low-level laser light. This is a device that you buy, and it stimulates the hair follicle via light, via a certain wavelength. All right, now leaving injections and onto topicals. Some of the topicals we use for hair loss include Finasteride, which again is blocking that DHT hormone from being made. And Finasteride, the evidence is actually kind of weak, so it works a little but not that much. What about microneedling? This is when you're using little tiny needles to damage the skin on the scalp, and that also helps stimulate the skin of the scalp. The evidence for that is weak to moderate. And what about exosomes? These are a newer thing that we do, and the evidence for exosomes is moderate. So what is an exosome? Exosomes are something you buy, well, your office buys. It's shipped to the office in a bottle, and it derives from healthy donors. In this case, we'll use the example of fat. So they take fat from a healthy donor, and they harvest these stem cells, and these are quote-unquote adipose-derived, meaning that they came from the fat. These stem cells, they harvest them to make more of them, and theoretically, these stem cells have the information to turn into a fat cell, a cartilage cell, bone, muscle, skin, liver, vessel, neuron, pancreas. It has all of this information about things it could potentially do. What they do in the lab is culture these little tiny particles that contain that information. So when we inject these molecules into the skin, they're like little envelopes with instructions. So if the envelope says, make more collagen, the skin will make more collagen. So the evidence for this is, like we said, moderate. It's still relatively new and not super common. Let's talk cosmetic treatment. So hair fibers are very popular. Toppik is the most popular brand, and these are hair fibers that stick onto the hair strand, and it makes the hair appear thicker in nature. Another cosmetic treatment option is scalp micropigmentation. This is basically tattooing the skin on the scalp in order to make the hair appear fuller. Finally, you can buy a cranial prosthesis, or basically wig or lace front wig. This is possibly covered by insurance. Not all the time, and the wording has to be very specific. And onto hair transplant. This is the most aggressive treatment option. It's a surgical procedure where they take hair from the back of your head and put it onto the top of your head. There's a few different ways to do this. First, this is a follicular unit transplant. That's where they take a strip of skin along with the hair. There's also follicular unit excision, which is when they take individual hairs and put them on the front. These are very costly options, but they are more permanent. And onto lifestyle changes you can make for your female pattern hair loss. First, we'll talk supplements. There are many supplements that are advertised as hair, skin, and nail supplements, which is mostly biotin. There's no evidence that works for hair. You can skip that. And there's other supplements you can take. There's Viviscal, which is shark cartilage. There's Nutrafol, which contains hydrolyzed collagen and other things to stimulate the hair follicle. These supplements can be pretty costly. I find that some patients love them, swear by them. Some patients say they did nothing and they wasted their money. Another lifestyle intervention is eating a healthy diet. Get all the vitamins and all the minerals you need. You need protein, you need building blocks for the hair. Also, as everything in life, if you can reduce stress, all the better. Chronic stress, it flares your immune system. It's not good for anything. Also, gentle hair care, no tight hairstyles, nothing that could damage the hair follicle. Avoid heat as best you can. Try to use a wide tooth comb and air dry when you can. And just good gentle scalp care, gentle shampoo. And if you can get regular scalp massages to stimulate the hair flow, that helps too. I wish that was a prescription. Finally, in addition to all the more medical information we talked about today, just good support, good coping skills, rely on friends and family or support groups, whether they're online or in person. And social media is a good option too. There's a lot of forums you can try where women share their experiences and a lot of tips and tricks as well. And that is female pattern hair loss.